Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Pimozide. Its brand name is Orap. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this video, we'll discuss the mechanism of action, or how this medication works, indications or reasons to prescribe medication to a patient, followed by contraindications or reasons we would not be able to prescribe Pimozide. We'll then touch on an example of dosing and finish it off with side effects. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So the exact mechanism of action of Pimozide has not been established. It blocks dopamine receptors in the central nervous system, and the efficacy of Pimozide in suppressing the tics of Tourette's syndrome is thought to be due to the dopaminergic blockade. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see Pimozide prescribed in the treatment of Tourette's syndrome. With respect to contraindications or reasons we would not be able to prescribe Pimozide, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Pimozide or to any other component of the formulation. If a patient had a history of cardiac arrhythmias, they would not use this medication, as well if they had congenital long QT syndrome. If a patient had hypokalemia or low potassium, as well as hypomagnesemia or low magnesium, they would also not use Pimozide. Lastly here, if a patient had severe toxic CNS depression, that would be a contraindication as well. Now for an example of dosing with Pimozide. So in the treatment of Tourette's syndrome, we may see an initial dose of 1 to 2 milligrams a day orally in divided doses. The patient may increase the dose gradually every other day. For maintenance, we would see a dose usually less than 10 milligrams per day, or 0.2 milligrams per kilogram per day, whichever is smaller. Doses greater than 10 milligrams per day are not recommended. As with all medications, there are some side effects or adverse reactions that patients may experience while using Pimozide, so we'll go over some of those here now. Some patients may experience orthostatic hypotension, which is a sudden drop in blood pressure when going from a seated to a standing position, while other patients may experience diminished sweating, photosensitivity, or constipation. Xerostomia or dry mouth is a possibility, as well as akathisia or dizziness. Parkinsonism and somnolence may occur with Pimozide, as well as blurred vision, urinary retention, or nasal congestion. The more serious side effects include prolonged QT interval, a seizure, priapism, or a granulocytosis. Alright everybody, that's all we're going to talk about today with Pimozide or Orap. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. That's it for today. Take care.